Weight loss drugs are a hot commodity. In the past 3 years, the number of young people taking them has shot up nearly 600%. The fad becoming the latest mockery of the satire show South Park.
It's time for some drastic measures to bring down his weight. There's these new crazy drugs people are doing. Have you heard of semaglutides?
Semaglutide?
Ozempic, Mounjaro.
South Park, the end of obesity.
They're popular and pricey. A new study shows the profound impact it could have on the U.S. healthcare system if they become more widely covered by Medicare and Medicaid. A Senate committee is investigating the parent company of Ozempic and Wegovy, Novo Nordisk, for how they price their weight loss pills. Novo Nordisk responded, saying it's willing to work with lawmakers to lower prices. Unless someone can get the drugs covered by insurance, they're paying a pretty penny. Ozempic costs $12,600 for a year's supply. Wegovy retails for $16,200 per year. Mounjaro and Zepbound are a little less than $14,000 a year. If someone does qualify to have it covered by Medicare or Medicaid, then the burden falls on the federal and state programs to cover the hefty price of the booming weight loss drugs. Researchers estimate that providing Wegovy to all 19.7 million Medicare beneficiaries with obesity would cost $268 billion. If the drug were just given to patients clinically diagnosed with obesity, it would still be more than $135 billion. That's more than what Medicare spends in an entire year on retail prescription drugs. A recent report by a Senate committee found major disparities in the price point Americans pay for the drugs compared to other countries. Americans pay $1,300 a month for Wegovy. The same medications cost less than $200 a month in Denmark, Germany, and the UK. Senator Bernie Sanders chairs the committee investigating Novo Nordisk. He says if the prices for these products are not substantially reduced, they also have the potential to bankrupt Medicare, Medicaid, and our entire healthcare system. The prices for these drugs are so high in the United States that everyone, regardless of whether they use the products, will likely be forced to bear the burden of Novo Nordisk's profit-maximizing strategy through higher insurance premiums and taxes. Novo Nordisk responded to Senator Sanders by disclosing that it retains approximately 60% of the list price of Ozempic and Wegovy in the U.S., and says the rest is paid to the middlemen involved in a complex U.S. healthcare system. Novo Nordisk also defended itself by pointing to the $10 billion investment they made in the drugs over the span of a decade, but do say they'll work with lawmakers on pricing to tackle what they call systemic issues. It's a drug that's all the craze, and with 42% of American adults classified as obese, the demand is there. The highly sought-after drugs are pushing the debate over drug prices front and center, as Congress and Novo Nordisk now agree to come to the table to discuss whether to make it more affordable. I'm Kara Rucker. For more stories like this, download the Straight Arrow News app or visit us at san.com.